Bismillah ar-Rahman ar-Rahim. Today we will complete the diseases of the larynx. Here we reach to this disease is the mucus retention cyst. Mucus retention cyst is usually seen when a mucus gland are abundant on the epiglottis, the ventricular band, and the upper part of the vestibule of the larynx. The cyst is filled with mucus, as you see in this picture, and the color is toward whitish to yellowish in color, and the treatment is by surgical resection or marsupialization. Just open the cyst and evacuate its content. Another disease, also it is common, the polyps of the vocal cords or the larynx. The polyps are smooth sessile or pedunculated swellings of the vocal cords. As you can see, this is the true vocal cord and this is the false vocal cord, and this is the affected cord on the other side, and this is the false cord. It probably represents a localized area of chronic oedema in the lax soft tissues of the larynx space, easily stripped off endoscopically. طبعا stripping هو just a longitudinal incision along the whole cord, and with a laryngeal forceps will clear this condition. The larynx space is a space lies immediately under the epithelia of the larynx and superficial to the elastic layer, which forms the bulk of the true vocal cord. Now, another disease is the Laryngocele. It is a bulbous air containing prolongation of the laryngeal ventricle and saccule. This slit-like space, which is filled with mucous glands, as we said, is filled now with air, which is coming from the respiration or due to Valsalva maneuver and stuck in this space. It's sometimes bilateral and is more common in men with a peak incidence of 50 to 60 years old. It could be an internal laryngocele, external laryngocele, or a combined internal and external. The internal type is confined to the interior of the laryngeal framework. It does not go out of the larynx and present under the mucosa of the valleculae. شوف الفاليكولا اللي هي depression على شكل depression تكون filled as a smooth lobulated or smooth swelling. The cyst can be uncupped in this area endoscopically, but the external type, here the enlarging herniation finds its way outside the laryngeal structure by piercing the thyrohyoid membrane. As to say, it lies between the thyroid and hyoid bone, thyroid cartilage and hyoid bone. In this area, connecting these two structures, the thyrohyoid membrane. الcombined طبعا هو the two together, the internal and external type. As we can see, the external type can be present as a swelling in the thyrohyoid region, like in this picture, in this area. Expand on cuffing and empties on digital pressure. يعني patient هنا can press on this swelling and empties the air inside it, while the internal type is seen as a smooth submucosal swelling in the valleculae with a muffled and hoarse voice. طبعا it will affect voice production and causes a hoarseness or muffling of sound. Diagnosis, as you can see by X-ray. نشوف air filled sac lateral to the larynx above and lateral to the larynx, and during Valsalva maneuver it extends easily after doing Valsalva maneuver and empties on digital pressure. Treatment طبعا surgical treatment, special surgery is done for this type of disease. Entering of the air is through this slit between the true and false vocal cords in this area. Now, oedema of the larynx. This term refers to an oedema of the laryngeal mucosa. almost always above or below the true vocal cords, but may occur in the subglutis or supraglottis. Etiology, we have different etiologies. Infection is the most common one, as in laryngitis, especially if the cause is streptococcus or diphtheria, and it spreads of infection from the nearby structures like the peritonsillar abscess or Ludwig's angina or retropharyngeal abscesses. The second etiology, trauma, like in foreign bodies or in intubation, traumatic intubation of the larynx. And in tumors and radiotherapy, we have a resistant oedema in the vocal cords. It lasts for months. Also, perichondritis may cause this condition. We have a long-standing oedema with this inflammation of the perichondrium. And allergy, also special types of allergy like angioneurotic oedema or Quink's oedema. A special type of the allergy associated with the complement system. The intrathoracic diseases causes either venous stasis can cause this oedema also. And finally, generalized diseases like cardiac failure and renal failure, which are known to have to cause oedema in different parts of the body. Now, clinically, the patient have dysphonia and sometimes cyanosis and respiratory stridor. As we said, stridor in this type of lesions in the vocal cord above the vocal cords are inspiratory, while in the level of the vocal cords and subglutis mixed expiratory inspiratory, while in the lower respiratory tract expiratory stridor. Hoarseness of voice also is affected, and the oedema of the lax laryngeal tissues is seen on the indirect laryngoscopy. As in this examination, if you notice the voice of the patient, and these are the true vocal cords. As you can see, this flabby tissue and the whole vocal cords are touching each other only in the posterior part اللي هو يكون open, which is the area of the vocal process of the arytenoids open. That's why rarely we have complete closure of the gluteus. Still the patient have dyspnea or stridor, but it is not a complete obstruction. This is طبعا type 4 or stage 4 laryngeal oedema, when the two vocal cords touching each other through vocal cords. Now treatment is first by rest in bed in sitting position. We give a nebulized adrenaline with the same inhalation and oxygen with helium mixture, which may be helpful to decrease the irritation of the vocal cords. And steroids are very important in such conditions, especially hydrocortisone and dexamethasone. Hydrocortisone for the acute stage and dexamethasone for the maintenance. The antibiotics also are directed toward the cause of this oedema. And finally, adrenaline 1 in 1000 in a dose of 0.5 ml for adults, طبعا subcutaneously, and 0.1 ml for children, also subcutaneously can be given. Finally, tracheostomy may be needed in such cases as an emergency situation. Now, Laryngismus stridulus is part of a group of diseases called the laryngeal spasms. One of them is the Laryngismus stridulus. It is an episode of paroxysmal laryngeal stridor, and it occurs in young children, first decade of life, usually boys, commonly affected and begins and in winter time. الجو البارد تصير عندنا هاي الحالات. More frequently يكون patient ill health with ill health or malnutrition, which is prevalent in children, also associated with rickets. هذا الديزيز اللي هو vitamin D deficiency. والinfection أيضا another cause for this disease مثل whooping cough والsepsis in the upper respiratory tract, and finally spasms and tetany نتيجة الهايبوكالسيميا أو الكالسيوم deficiency. Finally, there is a passive obstruction by flabby soft tissues of the larynx, another cause. Clinically, the patient have stridor, cyanosis, and carbopedial spasm at the same time, but after a minute or so, the attack suddenly cease. رأسا يرجع طبيعي طفل مباشرة. والdeath is very rare following this breath-holding attacks. The treatment is usually during the attack. Respiration can be stimulated by splashing. نرش عليه وجهه أو على جسمه مي بارد cold water and pulling أو another procedure اللي هي pulling the tongue forwards. Attention هنا طبعا should be done directed to the diet, the vitamins and exercises. Another important subject is the paralysis of the larynx. Paralysis of the larynx is paralysis of the motor nerves. It may be caused by the lesions in the central nervous system or in the peripheral motor nerves to the larynx, which is the most important one هو الvagus trunk, vagus nerve, the superior and recurrent laryngeal nerves, and the condition is usually unilateral. Usually it is unilateral, and the left side is usually more affected owing to the longer course of the left recurrent laryngeal nerve in the chest. The paralysis can result from pressure or stretching of these nerves due to a disease or injury, which is usually surgical. طبعا after thyroid surgery will commonly encounter this condition, damage to the recurrent laryngeal nerve, or malignant diseases of the thyroid, especially thyroid, esophagus, bronchial trees, nasopharynx, and lymph nodes. Peripheral neuritis أيضا another cause of infection, infective أو toxic form نتيجة infection أو toxic من chemicals, toxins like lead poisoning, أو infective toxins like diphtheria, typhoid fever, influenza, or a vitaminosis أيضا leading to polyneuritis مثل beriberi disease. Now clinical features, the effect on voice and respiration. When there is a unilateral recurrent laryngeal nerve paralysis, the respiration is unaffected because the other vocal cord is abducting normally and there is a good airway, while the voice may be affected, especially in the first in the early stages. Patient at the hoarseness of voice, but he can accommodate for this after a few months ويرجع الصوت طبيعي بس ما يقدر يعطي صوت عالي. هاي المشكلة الوحيدة اللي تصير عندي. while bilateral recurrent laryngeal nerve paralysis يكون severe dysphonia is produced والvoice يكون good, it's not affected because we can approximate vocal cords easily, while the abduction is affected and there is a narrow airway and the cords are in a paramedian position. The superior laryngeal nerve paralysis are rarely affected alone. As we know, the superior laryngeal nerve supply the cricothyroid muscle, which is the major tensor of the vocal cord. The tension of the vocal cord يعتمد على هذه المصل، بالإضافة للتون of sound أيضا يعتمد عليها. فالcondition rarely occurs, as we said, without a recurrent laryngeal nerve paralysis. It could be أيضا unilateral or bilateral. هنا الvoice يصير rough and tires quickly because because the vocal cords are flabby ما بيها tension. والrespiration هنا يبقى نفسه is not affected, but if associated with the recurrent laryngeal nerve هنا الvocal cord is in a lateral position and inhalation of food may occur. هنا المشكلة تصير الاسبريشن كلش خطرة if it is associated with the recurrent laryngeal nerve. The effect on position of the cord شو يصير عندنا بالrecurrent laryngeal nerve paralysis the vocal cords are in a median position يصير بالmidline while it is either an unilateral or bilateral, while in combined paralysis of the superior and recurrent laryngeal nerves both of them the vocal cord will be in a cadaveric position. The cadaveric position هو midway between the median and the abduction position بالmidway. يعني هذا الابدكشن هذا الميديان يصير بالميدواي هو الكادافيريك بوزيشن. الباراميديان يكون more medially toward the vocal cord. Now this is a case of left recurrent laryngeal nerve paralysis. The patient also have another lesion as we can see. شوفوا هنا الاريتينويد هاي كلش حالة مهمة تشوفونها tilted this way and the right is moving normally while the left is fixed, and we have two patches of leukoplakia on the right cord if you can see. Notice that also again the left is paralyzed, the right is moving, the arytenoid is tilted on the paralyzed side شوفونها tilted medially rotated, and on phonation the sound is weak but he can produce sound, clear sound, but he cannot shout in a loud sound. Now treatment in such cases in bilateral paralysis هو المهم عندنا تصير عندنا dysphonia ويصير stridor, and tracheostomy maybe is indicated in this condition especially during surgery. شوفون دول أول ما يصير extubation after thyroid surgery يصير عندهم sudden closure of the vocal cords ويصير عندهم رأسا stridor وdysphonia ويقل الأكسجين فيحتاجون tracheostomy. For the chronic cases arytenoidectomy is indicated. We remove the arytenoid in bilateral cases either endoscopically or external by external approach, and nowadays by laser can be done. In unilateral cases improving the voice by various phonosurgical procedures can be done. Injection techniques so injection للvocal cord واندفعه toward the we push it toward the normal side حتى يصير complete closure ويصير عندنا normal voice. Spontaneous طبعا recovery may occur after even 2 years later, so we have to wait and reassure the patient to wait till the full recovery occur after this condition. Now another subject هو functional paralysis أو hysterical dysphonia or aphonia. هذه تشوفونها طبعا بالemergency ward. يجيكم patient functional paralysis هي الادكترز during phonation occurs most often in emotionally unstable individuals, particularly طبعا women. تجيكم young women وتحكي هيك whispering ما عندها sound. فالأفونيا sometimes complete نهائيا ما يطلع صوت أو اليوجوال اللي هو يطلع whispering sound, and the onset and recovery is sudden. يعني يصير sudden ويصير الريكفري أيضا sudden. و important note أيضا عندنا الكف reflex is الكف is normal. When you tell the patient to cough he can cough easily and normally. هذا كله goes with the functional paralysis. التريتمنت طبعا psychological assessment is indicated, and the speech therapy is the treatment for such condition. And you can see now this case of functional paralysis or functional aphonia. You can see a gap between the two vocal cords. This gap always stay between the two vocal cords, فيصير عندنا هذا whispering sound أو weak sound, very weak sound، أو أحيانا يصير aphonia. فهنا ما عندنا أي lesion باللارynx مثل ما تشوفون، بس the closure of the vocal cords is affected and the patient can heal suddenly. The condition أيضا begins suddenly, the patient can heal suddenly. Now another lesion اللي هو dysphonia plica ventricularis. الventricular band هو نفس false vocal cords. هنا the patient uses his false vocal cord for phonation. This is faulty production of sound by opposition of the false vocal cords. This may be part of an attempt to compensate other vocal disabilities. واحد يتعب صوته فيقوم يضغط على نفسه، يقوم يطلع صوت، يحاول يسوي closure للفولس vocal cord حتى يطلع صوت أقوى، ويصير عنده هذه المشكلة اللي هو الفويس هنا يكون unpleasant, low and rough in character. and the treatment طبعا هنا الفويس ريست essential. دائما نقول الفويس ريست. الفويس ريست مو معناته ما يحكي نهائيا، وإنما يحكي قليل ويحكي بصوت واضح. دائما يحاول يحكي بصوت واضح، ويا طبعا السبيتش ثيرابي is very important. Now this is a case of this condition.
Respiratory infection. On our endoscopic examination in the office with a fiber optic laryngoscope, you can see that the vocal cords are mobile and adduct and abduct normally. However, on closer inspection, we see that the false cords are approximated on phonation. The vocal cords themselves
شفتوا مثل راح تشوفون هسه الفولس فوكال كورد يصير بها approximation.
The false cords
وما عندنا أي باثولوجي باللارynx.
This is due to a hyperactivity of the muscles. Speech therapy and stroboscopy are recommended for this patient.
As you can see, this is very clear. Now, يصير عندنا الفونيشن عن طريق الفولس
Again,
vocal
you'll see
cords.
that the false cords are approximating, which is an abnormality. This is what causes the voice to have the low pitch